Thank you for joining us for another episode of the Making Healthcare Better podcast. I'm McCrae Brennan Fuller. Today, we're going to be talking about how adult Medicaid waivers socially impact healthcare access and quality. Joining me today is Tonja Wragg. Tonja, thank you so much for joining me to talk about this interesting topic today.
Thank you. It's my pleasure. Thanks for having me.
Absolutely. And can you share with us a brief description about your role at Alliant?
Yes, I am the manager of waiver programs. I'm a registered nurse and I'm also a certified case manager. I oversee all of the adult Medicaid waiver programs that are funded by the state Medicaid under the Department of Community Health.
Perfect. Thanks so much for sharing that with us. And, as we dive into our topic today, I think it's important that we reflect back on the definition of social determinants of health, which are the conditions in the environment where people are born, live, learn, work, worship, and age that impact overall health and quality of life outcomes and risks. Tonja, thinking back on the definition, could you share some examples of how the use of adult Medicaid waivers impact healthcare access and quality from a social and community context? Perhaps start by telling us a little more about what adult Medicaid waivers are and how someone can apply.
Sure. The Medicaid home and community-based services are basically services that can be provided in the home of a disabled person, elderly and disabled persons. Like I said, our services cover anyone from age 21 to over 100. And these waiver programs provides case management, personal support, skilled nursing, medical supplies, and emergency response, which is all the things that we need to live in a community setting. And the waivers are able to provide that for a patient and allow them to prevent them from going into an institution. And that's important in order to have a good quality of life and so that people can not allow their disability to control how they live their lives.
Absolutely. Thanks so much for sharing that information. I think it's important for folks to understand what the program is, but how it can be utilized. I know here at Alliant, we're really big on stories of impact. Do you happen to have any beneficiary stories that you can share with us on how the adult Medicaid waiver has positively impacted someone's life?
Absolutely. It was several years ago. I was an assessment nurse. That's when we were traveling all over the state. It was before we really started the telehealth. And I went down to Statesboro, Georgia, to Georgia Southern University to see this young man who was a college student. He was born with a condition called muscular dystrophy, and he had a tracheostomy and a ventilator that he had to be on 24 hours a day. Well, the ICWP program, he was very vibrant, very young, and just excited about being on the college campus with his peers. So the ICWP waiver program enabled him to go to college and have the care that he needs so that he can feel just like he was a college student among his peers. We provided a personal support attendant to assist him with his home activities of daily living. A skilled nursing person came out, either RN or LPN, came out several times a week to make sure his ventilator and his tracheostomy was functioning properly. And this enabled him to complete college. And to me, that story always resonates in my mind because I know that that young man was excited to get that and finish college and just lived a life that he really wanted to live as if he didn't have a disability.
Absolutely. It's always empowering to see people overcome challenges and still achieve goals and, achieve success in life. I think, now more than ever, it's important for people to have a voice in their own care management. What are some examples that you could share that Alliant is currently doing to improve healthcare access and quality for the customers we serve?
Yes, Alliant has mastered the use of telehealth. I like to always throw that in there because we were all already using telehealth a couple of years ago when we did our first telehealth assessment for a patient that was in South Carolina. Well, since then, they've developed new software. Such as Zoom, WebEx, and all of those technologies to where you can use them to access patients outside of a doctor's office. So Alliant has mastered the use of using video assessments to conduct our assessments. So when the pandemic hit, it really didn't slow us down. I think, as a matter of fact, I think our assessments actually went up during the pandemic because people realized that they didn't need anybody to come into their home. The nurse was able to actually physically see them and identify what their needs are so that they can live safely. And then also, they realized that it is okay to see your healthcare professional via telehealth. And our review nurses made it very comfortable for them to use those technologies by training them before the assessment even started, doing like a dress rehearsal, making sure that they understood how it was going to work. And then when the assessment actually occurred, they were comfortable proceeding and making and knowing that we were going to assess them and give them the services that they need.
Absolutely. I think based on the information that you've shared, it's safe to say that Alliant was definitely ahead of the curve as the COVID-19 pandemic hit.
Absolutely.
Tanja, thanks so much for these insightful comments today. I think this was really helpful for the people we serve to really understand more about the adult Medicaid waiver program and how someone can apply.
Absolutely. Thank you for having me.
Absolutely. Thank you again for joining us, and thank you for joining another episode of the Making Healthcare Better podcast.